My name is Jenny, and I'm a fourth-year medical student at Duke and a current 2019-2020 Feagin Scholar. I figured if I was going to film something on how COVID-19 has affected me, it made most sense to do it in the corner of my house that epitomizes one of the biggest changes to my life since the pandemic has hit. So I have an 18-month-old daughter. Daycare is still open, but they're trying to limit numbers in order to limit exposure. So since I am finishing med school online, I decided that I could keep her at home and try to do the stay-at-home mom thing. So it's definitely been a steep learning curve, but we are getting there with a lot of help from some of my other parent friends. I think this has been a difficult transition, especially since it's hitting during my fourth year, so during the time that I am transitioning from being a medical student to actually joining the medical profession. The live classes were canceled during my capstone course, so that's a time when fourth-year medical students all come back together in the classroom, learn the rest of what we need to know to be July interns. And it's a really great way to bookend our undergraduate medical education. We were able to finish the content with some changes, but lost the social aspect of it. For me, one of the big losses was the cancellation of the pediatrics boot camp, which it would have been really good to learn the information, but also would have been an opportunity for me to have one last day with a lot of the physician leaders and mentors who have really helped me in my decision to pursue a career in pediatrics. Another thing that has been especially difficult as a graduating medical student is the loss of graduation. I am a Durham native. I grew up here, and I spent plenty of time as a kid at Duke Chapel. My dad is also on faculty at Duke, so taking the Hippocratic Oath in Duke Chapel, getting hooded by my father in order to join this profession would have had a lot of personal significance. And so to lose that has been a pretty tough loss, just for me personally. In terms of professional questions or difficulties, I'm not participating in patient care right now, but at the same time, the only thing that stands between me as a medical student and me being a physician is the amount of time it is going to take before they confer our degrees. I've completed all of my requirements for medical school. We just haven't hit our graduation date. So a lot of my classmates have expressed feelings of frustration that there's more that we can be doing, should be doing. I know in some states, medical students have been graduated early so that they might be able to join the workforce. But there's also a discussion on what role recently graduated medical students can play. We obviously need a lot of supervision at the beginning of our residency training, and there are questions of where that supervision can come from when it's really all hands on deck for dealing not only with the COVID pandemic, but also continuing to see all the other patients who come into the hospital with non-COVID illnesses and emergencies. So we are kind of in a limbo of wanting to help, essentially being trained to help to a degree, and not being able to right now. So that has definitely been a professional struggle for a lot of us, as well as not knowing what the beginning of residency is going to look like. It's tough no matter who you are, no matter what field you go into, but if things have not calmed down by then, there's a question of what our role is going to be in helping to care for patients during this kind of pandemic. On top of that, there is the continued conversation of physician burnout and resiliency. which would have been the topic of this year's Duke Health Leadership Summit that my team was working on planning and unfortunately was canceled due to COVID-19. There's been a lot of effort to try to take care of people, especially healthcare workers on the front lines of the COVID-19 pandemic, while at the same time recognizing there's been a lot more demand on them. And then everybody is affected by this, from people staying at home, from people needing to continue to go to their jobs, and people losing their jobs. It is taking a different kind of toll on everybody, and I think it's important that we acknowledge the toll that it takes on us. I've been very impressed by my community, by my classmates who have reached out to check on people and say, hey, how are you doing? But also by the people who have said, I'm not doing well, I'm not okay. As physicians and medical trainees, I think it's hard for us a lot of times to acknowledge when we're not okay and to ask for or accept help when we need it. I have seen a lot of people really come forward and offer specific help, whether it's volunteering to bring groceries to people, whether it's helping with childcare for the physicians who have to go in when schools are closed. There are a lot of different efforts that people are making to reach out and help their community, but also to reach out and help each other. I have had a lot of texts from classmates, from friends who have said, I'm not okay with this. This is not okay. This is not a normal situation, and I'm not handling it well. And we can jump online and have a virtual conversation, get some of that social contact, which has been incredibly helpful for my mental health, for mental health of a lot of my classmates. You know, I am somebody who is an extreme extrovert, so the social isolation that comes with social distancing is really difficult for me, and it's something that I have been having to work through, especially using virtual meetings to have some semblance of face-to-face contact. I've also had to ask for and accept help a lot more than I normally would. I have reached out to experienced parents to figure out how to care for my kid. I have talked to physicians and residents about what to do when you are a healthcare worker during a pandemic. I have sent emails with some of my med school mentors just to stay in touch and fill in some of the gaps that were caused by not getting the end of the year that we expected. And I'm also continuing with other things that I was doing for my mental health before COVID-19 hit. So trying to keep up with some of my hobbies. I like to play piano, so I've been doing that a lot more, and engaging in telehealth, mental health services to make sure that I'm taking care of myself in order to be present for my daughter, for my husband, and make sure that I'm in an okay place when I start residency in just a couple of months. So the big takeaway that I have is it's okay to acknowledge that you're not okay. Most of us are not okay in some way. It's okay, even important, to ask for help. So ask for it if you need it, offer it if you can, in whatever way you can. Everything helps right now, and I don't think there's any way we're getting through this alone, even if we're physically isolated from one another. This is very much a community effort, so we protect ourselves by making sure that we're taking care of each other.